Hi guys, welcome back to Educate channel. So today we will be discussing about the veterinary medicine topic, that is classification of animal disease. So whenever we are going for any competitive examination or subject level examination, we'll be really having some essay type of questions. So classify the animal diseases. So there are many criteria by which we can classify the animal diseases. So we will be discussing one by one all those classifications. So let's move on to the video. So please subscribe our channel and hit the bell button for more updates. So animal disease. So we can classify them on the basis of these criteria. So here are some criteria. So what is that? So according to the mode of origin or the genesis of disease, the involvement of system, the changes in the organ, causes or etiology, mode of infection, clinical manifestation and cause of disease, intensity and spread of disease, place of origin and source of infection. So these are actually the 9 criteria we'll be discussing. So we can discuss each one. According to the mode of origin or genesis of disease, we can classify them as hereditary disease. So that is actually transmitted offsprings to their sire or dam. So congenital is actually the developmental defaults which we are getting or which will be coming into the functional role when we are having an intrauterine life and appreciable at birth. So acquired disease, that is actually contracted during the lifespan. So according to the involvement of system. So localized disease, that is actually confined to a local spot or local organ. Generalized disease, what does that mean? It will be involving multiple systems, that is septicemia, toxemia, etc. So next is the changes in the organ, that is according to the changes in the organ. So structural disease and functional disease. Structural means there will be structural deformity or pathological deformity in the structure of an organ. So what is happening? Rickets, that is bone deformity, orchitis, that is testis deformity, nephritis, that is kidney deformity, etc. Next is the functional disease. That is actually, it will be affecting the functional role of an organ. So cardiac arrhythmia, valvular inefficiency, etc. Next is the causes or etiology. So bacterial, viral, rickettsial, chlamydial, fungal, etc. That is actually based on the etiological agent. So causes or etiology, we can also classify them as parasitic disease, protozoan disease like Babesia, Theileria, Trypanosomosis, Leishmaniasis, etc. Next is the microfilarial disease. That is actually the microfilarial humps and sores, etc. So based on this classification, according to etiology, disease can be divided into two. That is contagious disease and infectious disease. Contagious disease, that is spread by contact. That is contagious, contact. So FMD, PPR and all, they are actually contagious disease. Next is the infectious disease. That is microbes or infecting organisms. Actually by microbes, that is viral disease, protozoan disease, microtic disease, all are caused by infectious organism. Non-specific disease, they will be actually having multiple etiology, that is diarrhea. It can be due to E. coli, Shigella, Klebsiella and all. So pneumonia, that it can be actually due to virus, bacteria or protozoa. Next is actually the mode of infection. So primary disease, secondary disease, intercurrent disease. So primary disease, that is actually independently and not influenced by another disease, that is FMD, CED, rabies, etc. Secondary is actually, you will be having a primary problem and due to that problem, your immunity will be lost and due to that, the secondary infections come. That is secondary pneumonia is very common. Intercurrent disease is actually equivalent to the primary disease. That is, if at all one animal is having FMD, it will be, whenever it has got a recovery, but it will be having disturbed thermoregulation. So it is known as panther cow because due to the thyroid gland problems. So according to the intensity and spread of disease, they are classified as sporadic, enzootic, epizootic, endemic and panzootic. So according to the place of origin, they will be classified as indigenous disease, that is present in India itself or our native place itself. Exotic disease, that is actually coming from the exotic place. And emerging disease, that is actually which is emerging and we don't actually have the proper details about that. Next is the source of infection. That is endogenous disease. That is, disease is coming from the inside of the host system due to lowered immunity and all. So exogenous is actually due to the feedstuff, secretions, oil and water, excretions and feedstuffs from the other area. So thank you guys.